Good afternoon, everyone. On behalf of the college, I want to thank you for joining us today for the webinar on the Standard for Infection Control. My name is Anya Walsh, and I'm the Manager of Registration and Quality Assurance at the college. As COVID-19 continues to spread, it is more critical than ever that we continue to follow strict infection prevention and control protocols. Today's webinar provides an opportunity to review the college's standard on infection control in relation to the pandemic. Before we start, we wanted to acknowledge and thank all the practitioners for your continued efforts and commitment to protecting patients, staff, and the community in these challenging times. In terms of our format for today, we plan to provide a detailed overview of the standard, focusing on the infection control principles. We will also include practical examples of how these principles apply in members' practice. At the end of the presentation, we will answer a few questions about infection control and COVID-19. We have also enabled our Q&A feature, which is located on the right-hand side of your screen. If you have any questions throughout the webinar, type them into the box and we will do our best to answer your questions. You can also send questions regarding this and other topics to the college by email, and we will answer them as soon as we can. Our email contact information will be provided at the end of the webinar. A recording of this webinar and the FAQs will be available on the college website within the next few weeks. I also wanted to mention that although we are unable to provide a certificate of attendance for this session, you may still count the webinar toward your professional development hours. And finally, I'm happy to be joined today by Sean Kosman and our special guest, Fanny Ip. Sean is the college's policy and governance analyst and worked closely with the Quality Assurance Committee on drafting the standards for infection control. Fanny is a registered traditional Chinese medicine practitioner and acupuncturist. She has collaborated with the college in the past on projects such as the record-keeping webinar. Sean and Fanny, thank you again. The stage is yours.
Thank you. So we go into the first slide. I'll start off with a brief explanation of what standards are. So standards describe the expectations for professional practice. And they're compiled, written down, and formally approved by the college. An overarching standard for traditional Chinese medicine practitioners and acupuncturists in Ontario is to provide high quality, safe, and ethical care to patients. The standard sets out an expected performance level against which actual performance can be compared. If you want more information on standards of practice, we do have a video that describes what standards are and what standards we have approved. Those are on our videos and webinar page on our website. Next slide. So getting into the standard for infection control, this standard was approved by the Quality Assurance Committee on September 30th, 2019, and was made effective on January 1st, 2020. Prior to this version, the standard for safe practice was used and has since been archived. This standard has three principles. The first is members must keep their knowledge of infection control current. The second is members must assess the risks for contamination and transmission of infectious agents. And the third is that members must carry out infection control procedures. Next slide. So the COVID-19 pandemic has meant that infection control is more important than ever. Practitioners have had to adapt to new procedures and regulations to ensure the safety of their patients, staff, and themselves. With the second wave of infections, practitioners are advised to continue following the directives and guidance from the Ministry of Health, Public Health Ontario, and the Chief Medical Officer of Health. The College Safety Course Handbook and the College's Return to Practice Guidance document provide TCM-specific information to supplement the information from the health authorities. To the extent that directives and guidance from the Ministry of Health, Public Health Ontario, and the Chief Medical Officer of Health, and other authoritative bodies regarding practices during COVID-19 and the college guidance differ, TCM practitioners and acupuncturists should be applying the higher standard basically, which means that if there's any discrepancy between our guidances and the Ministry of Health guidances, for example, you should go with what the Ministry of Health is recommending. So members are responsible for maintaining a safe, clean work environment. They must follow evidence-based procedures to minimize the risk of transmitting infectious agents. Because of the pandemic, there are additional measures to consider along with routine practices that practitioners must be aware of. So we will go through the 3 principles within the standard and then give you some, additional information on how you can apply this principle to your practice during the current pandemic. So next slide. So we will start with principle 1. Members must keep their knowledge of infection control current. Infection control procedures are the steps that healthcare workers must take to prevent infection from taking place or spreading in the healthcare setting. Infection control procedures are based on how an infectious agent is transmitted. This includes transmissions between patients, from patient to healthcare worker, and from healthcare workers to patients. Evidence-based procedures are steps that members follow based on solid, up-to-date research. Members must keep their knowledge of evidence-based infection control procedures up to date. For record keeping, members must keep infection control resources on file to help guide their practice. And now I'll turn it over to Fanny to provide with some examples on applying this principle to practice.
Applying these principles to practice, members must be able to identify the infection risks that occur in the practice of traditional Chinese medicine and any changes to infection control procedures. Members must also review and follow the recommendations from the Ministry of Health, Public Health Ontario, the Chief Medical Officers of Health, and other authoritative bodies regarding practices during COVID-19. Next slide, please. Understanding modes of transmission. There are 3 modes of transmission: contact, airborne, and droplets. Contact transmission occurs through touch. There are 2 types of contact transmission: direct transmission, which is patient-to-patient transmission, and indirect, which is person to object to person. Airborne transmission occurs when airborne droplets remain suspended in the air, travels on air current, and are then inhaled by suspectable people who may be nearby or some distance away from the infected person. Droplet transmission occurs when droplets carrying an infectious agent exit the respiratory tract of a person and come in contact with the mucous membranes of another person. These droplets usually travel less than 2 meters and can live on surfaces for a long period of time. In clinic, there are different sources of transmission that occur. 1, patient to patient. 2, patient to healthcare worker. 3, healthcare worker to patient. Next slide, please. In this slide, we're looking in case studies. We'll identify the modes of transmission, source of transmission, and what we can do to prevent these transmissions. Case 1, a patient with runny nose and cough, handling shared reading material while in the waiting area. The mode of transmission is contact, airborne, and droplet transmission. Sources of transmission is patient to patient and patient to healthcare worker. Prevention method: screening patients prior to appointment, ask patients to wear a mask, remove all reading material from waiting area. Case 2, patients with a cold, coughing in their hands without washing or sanitizing their hands after. Mode of transmission: contact, airborne, and droplet. Sources of transmission: patient to patient and patient to healthcare worker. Prevention method: ask patient to wear a face mask. Provide hand sanitizer for patient to use. Case 3, healthcare provider does not wash or sanitize their hands between patients. Modes of transmission, it's contact transmission. Source of transmission, healthcare worker to patient. Prevention method, practice proper hand hygiene between patients. Case 3, front office staff not wearing any personal protective equipment handling patient payments. Modes of transmission, contact, airborne, and droplet. The source of transmission, it's healthcare worker to patient. Prevention method, have office staff wear face mask. Case 5, practitioners not wearing PPE while dispensing herbs. Mode of transmission, contact, airborne, and droplet. Source of transmission, healthcare worker to patient. Prevention method, practitioners should wear a face mask, practice proper hand hygiene, and proper equipment sanitation. And now Sean will explain principle 2 of the standard. Next slide, please.
So principle 2 of the standard is that members must assess the risk for contamination and transmission of infectious agents. So assessing the risk in your practice involves 2 steps. The first is identifying the risks within the practice setting, which is the internal practice environment. And then they also must be aware of the risk present in their community and region, which is the external practice environment. The second step has become more apparent during the COVID-19 pandemic, and just goes to show how members should be aware of everything that's going on in their community as well as their practice. For record keeping, members should keep a record of their risk assessment to guide their infection control procedures. And I'll turn it back over to Fanny to show how this can be applied in their practice. Next slide.
When practitioners assess for risk in the internal practice environment, practitioners should consider the following. 1, the type of treatment plan for the patient. 2, the patient's overall health. 3, the health and immunization status of people in the practice environment. This includes other patients, practitioners, and staff. For risk in the external practice environment, practitioners should consider 1, the time of the year. For example, winter months would likely have an increased colds and flus. 2, outbreak of infectious disease in our community, like COVID-19. And 3, information released by public health officials such as Public Health Agency of Canada, Public Health Ontario, and municipal health authorities. Next slide, please. One of the tools of risk assessment for COVID-19 is the Ministry of Health's patient screening guidance document. The screening should take place over the phone prior to the appointment and when the patient arrives for the appointment. If the patient screens positive for COVID-19 over the phone or in person, practitioners should encourage the patient who has symptoms to complete the online self-assessment tool before calling the primary health provider or Telehealth Ontario for further clinical assessment. All screening questions are applicable to patients, practitioners, and clinic staff members. Examples of pre-appointment screening questions for COVID-19 are: 1, has the patient traveled outside of Canada in the last 14 days? 2, has the person come in contact with somebody that might be or am COVID-19 positive? 3, is the person waiting for a COVID-19 test result? 4, is the person exhibit any common reported COVID-19 symptoms such as fever and or chills, new onset of cough, worsening chronic cough, shortness of breath, difficulty breathing, sore throat, difficulty swallowing, decrease or loss of sense of taste or smell, headaches, unexplained fatigue, malaise, muscle aches, nausea, vomiting, diarrhea, abdominal pain, pink eye, runny nose or nasal congestion without other common cause, known cause. And 5, if the person is 17 years of age or older, or they experience any of the following symptoms: delirium, unexplained or increased number of falls, acute functional decline, and worsen of chronic conditions. There are 2 easy and quick physical screen process for COVID-19 that can be incorporated in all clinic settings. 1, use of touchless thermometer for temperature check, since fever is one of the first signs of COVID-19 infection. 2, use of an oximeter to check the oxygen saturation. Many COVID-19 patients do not exhibit symptoms, but physiologically would have signs such as reduced oxygen saturation due to lung impairment. Oxygen saturation level below 90% may indicate lung impairment. Please note that services from our members should only be provided when the anticipated benefit of treatment outweighs the risks to the patient and the practitioner. For more information, please refer to the Public Health Ontario website Personal Risk Assessment module. And now, Sean will discuss Principle 3 of the standard. Next slide, please.
Principle 3 is that members must carry out infection control procedures. So this includes creating and carrying out the infection control procedures which have been guided by the risk assessment in the previous principle. For record keeping, members should keep a detailed inventory of infection control supplies. Infection control procedures should be easy for members and staff to access as well. For workplace training, members must ensure that all practitioners, staff, and patients are familiar with infection control procedures. And now back to Fanny to provide some examples on applying this principle to practice. Next slide.
Applying these principles to practice. Members must have infectious control procedures in place for their everyday routine and COVID-19 measures. For everyday practice routine, these are the foundational levels of infection control to be used in a healthcare setting and identifies procedures that always apply with all patients. They are proper hand washing and personal hygiene, availability and proper use of personal protective equipment, cleaning, disinfecting, and sterilizing equipment and the practice environment, safely use and disposing of sharps and other biohazard waste, and sufficient equipment and supplies. With the pandemic, additional measures are required to maintain infection control in the clinic setting. These involves use of universal full shift masking, COVID-19 signage and screening, enhanced environmental cleaning, self-monitoring, and if necessary, self-isolation, and applying physical distancing. This includes appropriate waiting room setup. For more information, you can visit www.canada.ca. Next slide, please. In Ontario, we have the Just Clean Your Hands program. This program speaks of the 4 moments of hand hygiene. They are before initial client, patient, or resident contact, or contact with his or her environment, before any aseptic procedure, even if gloves are worn, after body fluid exposure risk, even if gloves are worn, and after contact with your client, patient, or resident, or his or her environment. There are 2 methods of proper hand hygiene. One is hand washing using simple soap and water. When your hands are visibly soiled, you need to clean your hands with plain soap and running water. If running water is not available, use moistened towelettes followed by alcohol-based hand rub. And 2, use of alcohol-based hand rub. The correct concentration of alcohol-based product is 70 to 90% alcohol. Next slide, please. Hand hygiene includes nail hygiene. Long nails are difficult to clean. It can pierce gloves, and it can harbor more infectious agents than short nails. Natural nails should be kept clean and short, not showing past the end of the finger. Chip nail polish or nail polish worn longer than 4 days can harbor infectious agents that are not removed by hand wash. Nail polish, if worn, must be fresh and has no chip. Artificial nails and nail enhancements are not to be worn by those having direct contact with clients or patients. Wearing of hand and wrist jewelry. Rings and wrist jewelry, except for watches, are not to be worn when providing care. Rings and wrist jewelry can act as a reservoir for infectious agents. It is recommended they not be worn by healthcare providers. If your usual role is to provide direct care, you should leave your jewelry at home. If facilities allow their healthcare providers to wear a ring, it must be a smooth band with no projections or mounted stones. Watches, if worn, should be able to be pushed up the arm far enough to allow hands and wrists to be cleaned properly. Besides the use of alcohol-based rubs and hand washing, there are other considerations for proper hand hygiene. They are: ensure hand hygiene products are available and easily accessible at all points of care. Gloves are not a substitute for hand hygiene. Do not use alcohol-based hand rub on gloves, as the chemicals can affect the porosity of the gloves, causing them to be more porous. This can mean an increased possibility of chemical or potential infectious agent exposure. Next slide, please. This diagram illustrates the proper hand wash steps as set out by Public Health Ontario. Wet hands with warm water. Do not use water that is too hot or cold. It is hard on your skin and will lead to dryness. Apply liquid soap or foam soap. In healthcare settings, bar soap should not be used for hand washing because it is easily contaminated. Lather soap and rub hands palm to palm. Rub in between and around fingers. Rub back of each hand with palm of the other hand. Rub fingertips of each hand in opposite palm. Rub each thumb clasped in opposite hand. After a minimum of 15 seconds, rinse hands thoroughly under running water. Be sure that all soap is removed, as soap will dry out your skin. Pat hands dry with paper towel. Rubbing with paper towel can damage the skin. Turn off water using paper towel to avoid recontaminating your hands. Dispose of paper towel into waste container. Next slide, please. This diagram illustrates the proper use of hand sanitizer. Check that your hands are visibly clean. If there is obvious soiling, follow the steps for proper hand washing. Apply 1 to 2 pumps of product to the palms of your dry hands. Rub hands together, palm to palm. Rub in between and around your fingers. Rub the back of each hand with the palm of the other hand. Rub the fingers of each hand in the opposite palm. Rub each thumb clasped in the opposite hand. Rub your hands until the product is dry. This would take a minimum of 15 seconds if sufficient product had been used. Do not use paper towels to dry your hands. Next slide, please. There are various types of PPE that practitioners may be required to use in their provision of treatment during the COVID-19 pandemic. These equipment include surgical or procedural mask. They should be non-cloth, single disposable mask for healthcare workers. The mask must be disposed of if it becomes wet or soiled. Lab coats, gowns, scrubs can be disposable or reusable. Gloves are task specific and single use for the task. Do not use in the hallway or non-patient care area. Examples of eye protections are goggles, face shields, or visor attached to the mask. N95 respirator must be fit tested. They're only for aerosol-generated medical procedures with COVID-19 patients or for patients with airborne diseases such as active tuberculosis. Next slide, please. In the COVID-19 operation requirement health sector restart document, it outlines the considerations on how to determine the level of precaution required. Before every patient interaction, practitioners must consider a point of care risk assessment to determine the level of precautions required. For all interactions within 2 meters of patients who screen negative, practitioners should be wearing a medical, surgical, or procedural mask. Consider the use of eye protection, such as goggles or face shield. Perform hand hygiene before and after contact with the patient and the patient's environment, and after the removal of PPE. Note that patients with the signs and symptoms consistent with COVID-19 should not be seen inpatient for clinic services during this time. Next slide, please. You may also wish to post these Public Health Ontario posters in your clinic to promote proper PPE usage. These posters illustrate how to put on and take off PPE. To obtain these signage, please visit www.publichealthontario.ca. Next slide, please. Minimal PPE requirements during treatment. Acupuncture on limbs and trunk, you will minimally need a face mask and gloves if bleeding is involved. Acupuncturing on face, you will minimally need face masks and eye protection, and highly recommended to wear gloves. Dispensing herbs, you will minimally need a face mask and highly recommended to wear gloves. Next slide, please. Clinic environment and equipment. During the pandemic, there are many areas of the clinic that practitioners need to consider. 1, how to promote physical distancing with their office setup. 2, managing treatment areas and equipment used in patient or clinic contact, such as TENS machines, cups, forceps, treatment tables, chairs, and desks. 3, frequent cleaning of common areas and frequently touched surfaces, such as doorknobs, handles, light switches, pens, and payment keypads. 4, practitioners should only use disinfectant that have a drug identification number, also known as DIN. Check the expiry date of these products and use following manufacturer's instructions. 5, use of linens such as beddings and patient gowns. Disposable linen should be one-time use only and disposed of in appropriate waste container. Reusable linen should be placed in its separate container for appropriate laundering after one use. And 6, practice proper waste management. Next slide, please.
So this slide, we'll just go over some of the resources we've used so far in the presentation. So the best practices for hand hygiene in all healthcare settings, the 4th edition. The COVID-19 operational requirements, health sector restart. This is a document from the Ministry of Health that all members are required to follow at this time. You have information from Health Canada, the Safety Course Handbook, the Return to Practice Guidance, and the Telepractice Position Statement. All of this information can be found on our website under the COVID-19 section of our website. Next slide. Public Health Ontario has also provided an online learning resource for those wanting to refresh or expand their knowledge of IPAC best practices. So the website can be found on the screen and can be very helpful to healthcare professionals from any discipline. Next slide. So now we'll go into frequently asked questions. Over the past several months, we've been fielding quite a few questions from members asking how they should be adjusting their practice at this time. And we've put a few of them into this webinar to maybe hopefully provide some clarity. So I will address the first one. Can a practitioner refuse to provide treatment if a patient does not want to wear their mask? So practitioners should be instructing their patients to wear masks when they arrive for or receive treatment. If the patient cannot wear a mask due to medical condition or perhaps they have difficulty breathing, the practitioner would be expected to ask if the patient would be comfortable to wear some other form of face covering, such as a face shield. It is expected that members use their professional judgment when making treatment decisions and to determine if the anticipated benefits of the treatment outweigh the risk to the patient and the practitioner. This risk assessment may also determine if other PPE is necessary for the practitioner in order to the COVID-19 requirements. However, if a practitioner determines that the risk of providing treatment outweighs the likely benefit, the practitioner can refuse treatment to the patient at this time. If the practitioner decides to refuse treatment, they should have a discussion with the patient about the risks and why they are not providing treatment. The practitioner must also clearly document the decision and discussion in the patient's health record. You should carefully assess your individual situation by reviewing the document routine practices and additional precautions prior to exercising your discretion. For additional reference, please see the COVID-19 operational requirements health sector restart document. Next slide. So some of my patients cannot tolerate the scent of alcohol. Is it acceptable to offer them alcohol-free options?
Although it is recommended to have alcohol-based hand sanitizers available for patients and staff use, hand washing is also an effective method for hand hygiene. For patients that may have issues with alcohol-based hand sanitizers, having them wash their hands upon arrival and after handling cash or other items may be more suitable option. Non-alcohol-based waterless antiseptic agents are not recommended for hand hygiene in healthcare settings. This is based on the best practice for hand hygiene in all healthcare settings. Next question, please.
Do I need to replace my surgical mask after each patient or client?
Members are required to wear surgical, procedural, or medical masks at all times when they're in their place of practice. Members are not required to change masks between patients unless any of the following applies. 1, the mask becomes visibly soiled. 2, the mask makes contact with another person or their droplets or secretion. For example, it was coughed on. 3, the mask becomes damaged or compromised in any way. And 4, the mask becomes very moist to the point that the integrity becomes compromised. Next question, please.
I see patients in their homes. What should I do when providing home care?
Practitioners should follow all infection prevention and control principles and the additional COVID-19 precautions as outlined in the Ministry of Health's COVID-19 Operational Requirements Health Sector Restart document. For practitioners that provide in-home visits, these requirements will include screening patients and anyone in the same home using the COVID-19 screening guidance document and practice proper hand hygiene before and after entering the home and before and after using PPE. A daily log should also be kept of all the homes that the practitioner has visited while working. Any equipment used in the home should be cleaned and disinfected after use. For additional information, please refer to the Ontario's College's Return to Practice Guidance and COVID-19 resource page. Next slide, please.
Thank you. These are all the questions we have. Thank you, Fanny and Sean, for sharing your knowledge with us today. Your presentation highlights that we must continue to follow the Ministry and Public Health guidance for infection control, risk assessments, screening, PPE, and social distancing. In today's session, we went over the standard for infection control and some of the resources available to members. We also answered some of the frequently asked questions on this topic. If we were not able to address your questions today, we will do our best to get back to you at a later date. The recorded webinar and the list of FAQs will be available on the college website in a few weeks. And please remember that you may count the webinar toward your professional development hours. We hope you enjoyed today's session, and thank you again for joining us. Have a wonderful weekend, stay strong and stay safe, everyone. Thank you.